So today what I want to talk about is ideal teeth, and specifically ideal natural teeth. Why? Because when we're designing smiles, we're trying to mimic nature. We're trying to make our veneers look as natural as possible. If my patient were to go out to a fancy event, a fancy gala, were to be on stage, were to be on camera, and someone were to say, oh my God, who did her veneers? Who did his veneers? Then that would be a failure on my part. Again, my goal is to mimic nature. So when we're looking at ideal teeth, right, there's specific proportions and ratios we have of teeth, right? And a natural, beautiful smile. So for example, we're showing width to length ratios of relative teeth, right? So if we look at the central, right, we can see that a beautiful central might be at 85%. Now, what does that mean? An 85% ratio is taking the width of the tooth divided by the length of the tooth and winding up with this percentage here. So there are certain criteria, certain ranges of ratios we want to fall into, these percentages between adjacent teeth. And so again, we have to understand what are the natural ideal dimensions of teeth when you look at a natural, beautiful smile. So these are all things that we're studying. And so what we do is when we take natural teeth and we have our in-house lab designing, we don't just have to follow a mathematical algorithm. There's no formula. We have to take your face into account because that's where it starts. It starts with the face. We have to divide your face into facial thirds. We have to find what is the most attractive proportion for you. How do we decide on what length your tooth should be? Well, we're looking at what we find in nature and what's beautiful and natural, but we also need to pay attention to what fits you, what fits your personality, and importantly, what fits your face. So for example, if you have a shorter face or what we call a more brachicephalic face, then you know what? We're probably not going to design teeth that are too long. If you have a more dolichocephalic face, a longer, more narrow face, we're going to be able to have more room to lengthen those teeth. So it's not just about staying, again, within these mathematical proportions. It's more about fitting the teeth to you personally and tailoring it to you.